Going to call this meeting to order. Should I do it one more time? Hi. Call this meeting to order on, I went light because Dave has a headache. Anyway, call the meeting to order on January 11, 2023 for program and budget. Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And now a reading of the mission statement. Is there someone that would like to read the mission statement? Mark?
Got to press it really hard.
Okay, that's different, huh? The Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you, Mark. And now an adoption of the agenda. Is there a motion to adopt the agenda? Motion by Selena, support by Lori. All in favor signify by saying aye. Aye. Anyone opposed? No. Motion carries. Hearing of the public. Is there anyone from the public looking to address this board? Okay. Thank you. Item number 5, request to approve. Is there a request to approve letter A through E? Or are we going to take these? Oh, they're independent. I'm sorry. I'm sorry. A and B together. Amendment 1 and Amendment 2. Is there a request for A and B? A motion for A and B. Okay. Motion by Selena, support by Brian and Helen.
Is it on? Okay, it's red, so I didn't know. Okay, thanks. Good evening. Thank you for having me tonight. We're back to doing amendments in our eGram system. So some of the grants that we already submitted for under the state, they're coming back now for signature. So in October, we get our initial allocation from the state on some of these specialty grants that we have. And what happens at times is the state doesn't have all their funds available to allocate in eGrams at the time because they have to do it in advance of when they issue it. So then they have to make up. So some of the things on this agenda are like makeup, like they said, yeah, we're gonna get it to you, but it didn't get in the October eGrams budget amount. So some are being added now. Others, we have a couple new projects. And another, they had promised us some funds. They didn't have it in October, but now they found their unused money, and so they're able to fully allocate the original request amount. So in our substance use grant funds, we have some additional money. So $3,000 was originally supposed to be allocated to us in 2022 to do a prevention tobacco coverage study. So the state wants us to go out and make sure the people with a tobacco license really still exist. And it's this very complicated, kind of silly method, I feel, but they give you this map. And you have to walk the street around this map and hit so many tobacco retailers in that area and verify that, yep, they're still there and they're in existence. Well, last year they didn't put in the budget. And so some of the regions said, hey, we don't have the money to cover this. And so they pushed it to 2023. And so that's what, $3,000 is showing up to cover that. We've actually already done the study, went really well, and so that worked out fine. There's $150,000 being added to our treatment and access to pay for a priority population care manager. And so what's happened is under our block grant dollars, we have to follow a priority if we don't have enough funds or if there's a waiting list for services. And so our priorities start with pregnant injecting women, then any pregnant woman. It goes then on to any parents who may have had their children removed because of substance use, adults using drugs by injection. And then our very last added one was people under Michigan Department of Corrections. services. So anybody on parole or possibly probation even, that they would have a priority status above everybody else. So kind of in that order. So what was happening in certain regions of the state, the MDOC offices were not communicating or saying they were having problems communicating with the PHP to coordinate care and services. So the state said, all right, we will designate a person at each PHP to help with that role, in addition to our other priority populations. So that's what this is for, and we do have a person starting with us next week. So we're excited about that we'll have that up and going and running, so that will be a really great thing. Additional money, the 174,680, I don't have my glasses on yet. That's for pregnant and postpartum women's services. So that's a brand new service for us. So the state had grant last year, and they were looking to partner with another region. And so they asked if we would participate with this. And so for women who are pregnant and or 1 year postpartum, they want to have enhanced services offered to these women. So we'll partner with some of our opioid health home providers. We have 2 different providers that are willing to partner with us. So they'll give enhanced coordination with the OBGYN, with the children's pediatricians, to really make sure that first, pregnancy through first year is very successful for that individual in her recovery as well, and the child's. And so then we also have an outpatient provider, Care of Southeastern Michigan, who's going to do some of the specialized women treatment for us for that project as well. So we're very excited. The more women-enhanced services we can have in our community, the better, because our county sadly has been lacking in that as far as providers' willingness to do it. So this was a great opportunity to be able to get that. It's a 2-year grant, so this is year 1 of funding. Then under our other grant, our COVID supplemental grant, a lot of that was some of that playing around of money. So that big chunk of $375,000 for prevention, that was part of that original allocation we asked for. They only had 50 at the time to allocate to us. And so they're like, don't worry, we'll get it for you, but we'll have to get it to you later. So glad, yep, they came through just as promised. So that's really great. Then we got $60,000 in our COVID funding, ARPA budget for telehealth hub services. So we are paying one of our recovery community centers partnered with us, and so they have technology available through this grant for people who need to do telehealth services. So if I don't have, time on my phone, or I don't want to use my minutes for that, or I don't have a private place and I still want to do telehealth services, I have somewhere I can go. So they're coordinating and arranging all that for us too. So that's something really good there. The additional $50,000 is going to address for marketing. So we're going to partner with the CMH marketing plan and get some additional marketing out for substance use services this year, and accessing and hopefully get more people into care that way. We have $75,000 addition coming for technology services, unless I already said that one. So, the next one is the youth recovery services. So that was in our grant. They missed it. They said they would award it to us. They forgot to put it in the budget in October. So they added it now, which is good because we partner with one of our recovery community centers who focus on youth, and it's been going very well. Chippewa Valley Schools has agreed to partner with them too and give them space 1 day a week to bring programming in right there at the schools. So anything we can do to get our youth as young as possible, give them healthy, alternatives to substance use, we're very happy for that. So just some of the updates for some of the specialty grants. Great, thank you.
And so there's a motion on the floor, and there is a second. All in favor of approving, Dave, your name is here as well. Dave, do you have anything to add?
No.
Okay. All in favor of approving line items A and B, all in favor signify by saying aye.
Right? I have to abstain from that vote because it affects me directly.
Okay. Do I have, Mark is abstaining. All in favor signify by saying aye. Everyone voted it. All opposed? Motion carries. Item C, request to approve Aetna contract approved by legal. Is there a motion? Motion by Dana, support by Antoinette, and Dave. You have to press really hard.
There we go. I wanted to start by thanking Helen. Her ability to keep track of all, there's just a ton of those grants and egrams, and some are real small amounts, some are really significant amounts. I'm so glad she's here managing those, when those came up, and I'm like, I'll just have Helen present on those, so thank you very much. The two agreements you have are for Aetna and Molina, the two Medicaid health plans. You're used to approving contracts between us and providers under us. These two contracts are actually, we're the provider under the Medicaid health plans. As a reminder, Aetna, we did not renew the agreement under the My Health Link program. But in order for us to continue to support people who are with Aetna as a Medicaid health plan, that contract will allow us to continue to provide the Medicaid and perhaps even some of the Medicare covered services for those individuals. Molina, we are continuing our agreement under My Health Link, and this just will formalize some of those, our ability to report services and bill to them as well. Oh, and they are redlined. They're currently under legal review, or have been reviewed by legal. We are waiting them to go back to the health plans, us to get the final version. So for the full board, you should have the final formal version for your review and approval.
Okay, and thank you, Dave, for talking about both C and D. I think the motion was just for C, but what's that?
Sorry.
No, that's okay.
There's
And why don't we'll just take them one at a time. So motion C is on the board right now, request to approve the Aetna contract, just to carry it forward to full board. All in favor signify by saying aye. Aye. All opposed, motion carries. And then item D, a request to approve the Molina Healthcare Medicaid contract. Is there a motion?
So moved.
Support?
Motion by Brian, support by Antoinette. Dave, do you have anything to add? Nope. All right, all in favor signify by saying aye.
Aye.
Motion carries. Item E, request to approve the 2023 CMH CEO contract. And Phil, well, actually, we need a motion first. Is there a motion? Motion by Selena, support by Lori. Phil?
Going to take a minute to get used to this. Thank you, Mr. Chair. For our approval tonight, we have the signed CMH CEO contract for 2023 for Dave Pankatai. Megan and I worked with the executive's office since August. We would have been able to bring this in December, but we were working on it up until almost the very end of the year. So that is why it is coming to us now. I believe it's been signed and approved by everybody but this board. So just wanted to bring it forward tonight. If there's any questions, feel free to ask. Megan was extremely helpful with this process. I wouldn't necessarily call it a negotiation. Dave is considered a county employee, so he basically falls into the prism of a county employee here in Macomb. So that's where we're at. He was able to receive an increase, not as much as everybody else in the county, which we're getting anywhere from 5 to about 11 or 12%. Dave is sitting at about 3.8, and that's where we're at. If anybody has any questions, I'm happy to answer them.
Any questions? Donna?
Yeah, through the chair to Phil. Just wondering, what is anything different from the last contract? I looked it over and it looked to me like it was just the 3.5% or 2 point.
Yeah,
2.25?
it's 3 point. Everything else is exactly the same as it was prior. Just the dollar amount's different.
Okay, thank you. My microphone went off by itself, so sorry.
Selena?
So it was, the county has a matrix basically for all of its employees. And so he's basically on the executive pay scale and he's at the top of that pay scale. And just based on where he was last year to where he is now at that spot, that's the percentage of increase. Hope not. The thought is no. He should still continue. It's written in his contract too that whenever executives in that pay scale get raises, he will also get those same raises. And Megan and I had a long talk with the executive's office about some sort of executive retention plan, because we don't really have one at the county for not only Dave, but for our other heads of departments. And they were very open to that idea. The board chair is open to that idea for the Board of Commissioners. So that is something that we're hoping to hit the ground running with the exec's office this month or next month, to hopefully be able to include that in next year's contract.
Bill, this still has to go to full board?
Yes.
Any any other questions? Thank you, Phil, and thank you, Megan, and thank you, Dave. All in favor signify by saying aye. Aye. Motion carries. Receive and file. Is there anything to receive and file? No. Resolutions. A request to approve the resolution of Crystal's retirement. I read the resolution. It's very beautiful, 21 years of service, long time. Is there a motion to accept the resolution? Lori and then Selena. I'm sorry, Donna, I couldn't read. All in favor signify, oh wait, is there anyone that would like to say anything on this or speak to this? Tracy? Really hard.
Okay. Just obviously, the resolution does a great job of presenting it. Crystal is a very valuable team member that we're very saddened and concerned about her absence. We do have a plan, of course, with Libby and a couple other people jumping in to fill her shoes. We're waiting on the county to post it, and we're excited about, that's not true. It is posted, forgive me. It closed, I believe, yesterday or today. So if you know anybody, we're excited about the possibilities.
Thank you, Tracy. Selena?
I just want to say that I have worked for Crystal with her for many, many, many years on my professional side. She's going to be hard to replace, and she is an excellent, excellent employee. So I'm surprised. I'm just stunned. I'm disappointed. I'm sad.
Can we reject it?
I know. Can you tell her that I want to stop it?
Unfortunately,
call me
she's already
tomorrow.
left. We tried, but she's
Okay, we
already
tried.
left.
Said that half joking. Well, reluctantly, there's a motion on the floor to reluctantly accept a resignation, but we, of course, accept the resolution. But all in favor signify by saying aye. Aye. Motion carries. Item 8, other possible agenda items, CEO update.
There we go. It seems to go off by itself too, so I will, if I suddenly go a little softer, please let me know. Well, Happy New Year, everybody, and thank you for approving my contract. It is appreciated. Real positive good news is we will be holding a ribbon cutting event for our new pharmacy, Genoa, at our North Clinic site. The partnership with Genoa is, it's started out really well. It continues to be extremely good partnership. We met with them over there. Their staff are energetic, really enjoy spending time with people, explaining their medications, offering. I think the comment was, if you sit still too long, she's going to inject you with something to keep you vaccinated and healthy. They are a big company with a lot of resources. So when we mentioned a marketing, a PR event for the ribbon cutting, they're like, oh, we have a department that does that, and things like that. So it's going to offer us a really good partnership opportunity, but more importantly for the people we serve now. And it's open, anybody from the public can use it, but it's primarily there for the people we serve and their family members and stuff. Again, there's no wait. You could see your doctor, get your prescription, stop right at the pharmacy window, get it filled, and be on your way until your next appointment. So that's really good news, and stay tuned for the updates about the official ribbon cutting. Also with good news, thank you, a big thank you to Tracy. This was her brainchild from the get-go. Capella University. The county has agreements with a number of universities that provide discounts to county staff, which is a really good thing. But the offerings on the social science side were kind of thin. So for that reason, Tracy reached out to Capella and worked with the county, and we now have a formal agreement with Capella. It's 10% discounts and $5,000 to $20,000 scholarships for our staff. It also includes any of our contracted staff as well, so it's open to everybody. And I think even their family members as well. So real good news. Thank you, Tracy. Also this Friday, if you saw it in our workforce updates, there's a fundraiser for Crossroads Clubhouse. It's at the Big Boy Arena in Fraser. Hockey game, Motor City Rockers and the Port Huron Prowlers. Thank you, Mark. So yeah, $5 from each of those tickets will go to Crossroads. I think you have to put a special code in for Crossroads to make sure that the additional funds go to them. I met with the Macomb Intermediate School District folks the first day back into the new year, and it was a really good start to the new year. The collaborations there are strong, and we're working to make them stronger. We were talking about the mental health needs of students, which are significant. The state has earmarked a lot of money for the school districts to ramp up their mental health services. And in a lot of areas, when I meet with my counterparts statewide, the schools are pulling staff and resources from the community mental health agencies. Here in Macomb County, they're not interested in doing that. They want very much to partner with us to provide those needed services, which is good because, again, when I'm meeting statewide, the issue is, so the staff leaves the CMH, they're in the school, and then they start working with a child. The child goes into crisis. They have significant needs. They have to go back to community mental health, and then they're like, well, we don't have the staff to meet those needs. So it's a really good partnership. We are working on Project Search, which is the school-to-work transition model. We are working on some special transition planning for the students that are, the classroom is severely multiply impaired is the classroom determination on the school side. But these are young adults now who have medical needs, transportation issue, a lot of personal care. So we're working to make sure that there's services in the community available to them as they exit the schools as well. Also, again, thank you to Tracy. We are following up. One of our big goals is to do more with the schools for the children's mental health needs, like I said, are just significant. But our first responders are also seeing real increases in their calls that are mental health or substance use related. I met with a detective from the St. Clair Shores Police Department, and as a result, we're following up, and we're going to be hiring a clinician to work directly with that police department. And it'll be kind of our first test to see how that goes. The needs are great. It's, again, the staffing crisis is the significant issue in that. The needs are there. We have the revenues now to stand up some new programs, but then we need the individuals to do it. So we're going to start slow, make sure we can meet the capacity demands there, and I'll keep you posted on that. I need to go back to Genoa. Thanks to Helen, we did provide Narcan to the pharmacy there in our North Clinic too. So they had it available through prescription and different means, but we gave them our Narcan to distribute with free, no strings attached. The RFPs that you approved for the marketing media have been closed, and we'll be reviewing those. So we'll be bringing those, the selected respondents forward to the full board. The same for the crisis stabilization unit. So we'll be working on those at the same time. I'll be presenting on a panel at the Kevin Song Conference. It's in Jackson, Michigan, at the end of this month. Kevin Song is a suicide prevention group, so I'll be on a panel with that. The decoupling, so President Biden signed, let's see, at the start of the pandemic, Congress enacted the Families First Coronavirus Response Act, which included a requirement that the Medicaid program keep people continuously enrolled through the end of the month in which COVID-19 public health emergency ends. So in our monthly finance updates, you've heard that you've seen the chart where our Medicaid enrollees keep going up. That's because nobody was coming off of Medicaid during the public health emergency. At the end of the year there, December 29th, Congress set an end to the continuous enrollment provision. So they've decoupled that one provision from the public health emergency. So the public health emergency remains in effect, but now the continuous enrollment in Medicaid will be winding down. Basically, starting in April 2023, states can resume Medicaid disenrollments. So between April and June, I think, is what folks at the Michigan Department of Health and Human Services said. And then in June, they will pretty much be resuming normal practices. What does that mean? It means it's really important that we try to communicate with everybody who's on Medicaid that they submit all the paperwork to keep it, and if they've lost it, that they submit those. And the biggest group that we're concerned about is the folks with the Medicaid spend down. So statewide, that's going to be an issue. We're going to be tracking that closely and working with the folks at the state of Michigan. They've started, they knew this was coming, but we thought it would be at the end of the public health emergency. Now it's just, we do have the specific dates. So on the financial side, you'll be able to see the impact too as those people fall off. I have a document from the Kaiser Foundation, and they're assuming, and seems kind of a wild guess, somewhere between 5 and 20 million people are going to, maybe it's 14 million, people are going to lose Medicaid as a result of this nationally. So it'll be an impact. We knew it was coming. But again, we want to work with those people as much as possible to make sure that they're aware that this is coming and that they are getting the paperwork in as best as possible. Probably might not even be paperwork at this point. A lot of it's done online for the completion of your Medicaid application and stuff. So I'll wrap at that point. Thank you again.
Any questions for Dave? Donna?
Nice.
Let me just ask without the.
Sure.
I'm wondering if you could give a brief of the latest news from Lansing as it pertains to mental health, since we have a whole new legislature.
Yeah, that's an easy ask. The biggest news out of the state. So I talked about the My Health Link contracts. That's for the dual eligibles. We had just dodged the bullet from Whiteford and Shirkey's plans to reorganize the community mental health system. I think we might have had, it was days or maybe a week in there before it came out that the state plans to take the dual eligible folks out of the PIHP, CMHSP system and put them under the Medicaid health plan, a Medicaid health plan or a entity outside of us. It's called a DSNP, or a dual special needs plan. And they wanted to stand that up, I think, January of 2026. One of the summary reviews said that there would be a rather significant impact on our revenue. I'm trying to verify that, get another opinion about the impact on the total Medicaid revenue available in Michigan should they take those people out. At first, it seemed like a big percentage of the dollars, but then I was thinking about it, and I mean, we probably have all seen those statistics where it says, you know, there's like 5% of the people account for 30% of the cost. The people with Medicare and Medicaid do tend to have a lot of service needs and expenses in that group. So we'll continue to track it. And at future meetings, we'll continue to get more detail about the efforts. As far as policy and legislative committee, that'll be one of the key points, is that we would speak up and say, you know, we can manage those folks well within our system.
Any other questions? Nick?
No, I don't have a question, I have a statement. Dave and I have had this discussion, and I've also talked with the state association. They're meeting separately with Elizabeth Hertel. I'm meeting with her, others are. The plan that was put out is problematic, I think. The governor's office advised me that that's not the final plan. They had to put something in writing, that we've got this 2-year period to try to negotiate what actually happens or how it gets done. It was done in response to some change in federal law. So it is, Dave's absolutely right. We need to keep an eye on it, but we're already beginning discussions to figure out where this is coming from and how it's going to resolve itself out. And we'll take it up again at the Policy and Legislative Committee meeting once I get some more detailed information.
I did meet with the Michigan Department of Health and Human Service leadership last Thursday, and you know, the points continue to be that they're stressing access to services, and we are putting a lot of resources and efforts into that area for Macomb County as well. And then I mentioned meeting with the schools and the mental health needs for children. The state's doing a lot. They've formed a brand new department for children. There's a big focus on the children in foster care right now, and we were able to run some data reports, thanks to Rachel and her team, that we could look at how many children in foster care we're currently serving. So those are the kind of the trend areas. The CCBHCs and integrated health continue to get, those are good models, and we continue to try to support those, and we'll see expansions of those, I'm sure, through 2023. But access to services, the penetration rates, there was a state report that kind of broke down, you know, there's this number of people with mental health issues. These are the number of percentage of those that were actually received a service or were aware of it. So again, the RFP we have going out for marketing, we want to very much help spread the word. You heard all the stuff, but that Helen referenced, all those really cool programs that we have to offer to our communities. It's, you know, when somebody asks me, explain what you do, it's like, have a seat. And I still learn, you know, I'm learning things that we are doing out in our communities to help support people, and then what our providers are doing, and what our collaborative agencies are doing as well. So we got a lot going on, but we're on a really good path forward. And hopefully this time next year, when I'm giving an update, it'll be able to show that we've accomplished some of those goals and increasing access and
Any other questions for Dave? I have two questions, Dave. The first is about Medicaid, whether any of our members of our community are going to lose it. The answer is likely yes. And then is there anything, is it proper for us to communicate to them, to give them a heads up? Are we doing anything about it? Is that something outside of our bailiwick? Give them a heads up.
we were talking today, so the ask from the state is that we update their contact information, name, address, phone number, in the state system as best we can and as quickly as we can. So we are working with our staff and our provider staff to make sure that that information we have the ability to enter into the state's system and provide those updates. Because then the state will be sending out correspondence, messaging along those lines as well. And they're ramping up on the state side to handle that influx of request to renew Medicaid or start Medicaid.
Thank you. You answered the second question too, so thank you. Item B, just a reminder that recipient rights is meeting on January 19th at 8 a.m. at our admin building. Also, the full board meeting is on January 25th, 2023. Is there any other agenda items from the board or any other things from board members? No? And then item 9, hearing from the public. Is there anyone from the public looking to speak? Going once, going twice? No? Item 10, adjournment. Is there a motion to adjourn? All right, motion by Dana, support by Selena. All in favor, signify by saying aye. Aye. We're adjourned.